So I actually, ready to read them? Should these things be posted online? You can go ahead and post them online, but call your doctor first. You're not gonna get proper care from your peers on social media. So I accidentally ate a spoon while eating ice cream. There's kind of pointy, so I'm not sure if I should be worried. First of all, it's a spork. Be fair now, that's not a spoon, it's a spork. Get your utensils right.
I get it now.
And you're gonna be fine. If it passes your esophagus, it'll pass the rest of your intestinal tract. So I'm guessing it made it through your esophagus. What in the world would cause a person to bruise like this after a simple blood draw? Ask the phlebotomist that drew your blood. It's very common if you tear the vein a little bit to get an extravasation of blood. That is what a blood draw commonly looks like these days. Not everyone is lucky enough to get a direct hit on your venous draw. My boyfriend wakes up with his right eye red and irritated when he drinks more than usual, specifically when he's around a specific friend. I'm guessing they just drink so much together that he sleeps with his eye open a little bit, and he's probably either scratching his cornea or just drying out his eye. I don't think he's allergic to his friend. I resent the implications for his friend.
Did we just become best friends? Yup!
Is my pinky normal? It's been like this since I was a kid. No, that's hyperextension. This is what it can look like. I have that same injury right here, and you usually get, if you notice the tip of the pinky is going down a little bit, that's typically what happens with that. That's not a problem, but if you want it repaired, it's a surgery. You have to have that surgically repaired. Again, check an orthopedist on this, not social media. So whenever I lie down, my eyes water to the point of forming tears, multiple streaks down my face. Thought it might be because I wear glasses. The glasses are touching a pressure point. I wear earphones at night, but I will lay in bed without those, the tears still come. Two things occur to me. I mean, your eyes and your nose connect, right? Through your tear ducts. And if your tear ducts aren't functioning properly, you will accumulate tears in your eyes. And so there's something about lying flat for you that either perhaps the nose causes, the pressure in the nose causes the tear duct tubes in the nose to sort of close off, and things accumulate in your eyes. Again, not an issue. Dry eye is more of an issue for people. Uh-oh, why do my legs look like this? Whenever there is asymmetric edema, you have to worry about a deep venous thrombosis. So that person needs an ultrasound of his left leg there, and maybe we could work on his diet a little bit, because there seems to be some other issues going on. Congestive heart failure is another thing to keep out for, and there can be asymmetric swelling from that as well. Also liver disease, sometimes even thyroid disease, also just, again, venous insufficiency if this is an older person. But fundamentally, because of the asymmetry there, you'd want to get an ultrasound of that leg. Can anxiety and depression cause chronic pain? Absolutely, it's a very complex topic. Pain has two components to it. Pain has a somatic component. I hit my finger with a hammer, my tissue hurts here. I feel it in my parietal area of my brain. There's a second region of the brain called the insular cortex that gives pain its affective charge. Let's call it its misery component. And that is where feelings come from. If you have had trauma in childhood, very often the information coming into the insular cortex is disorganized and frightening. And so pain becomes this overwhelming experience in the insular cortex. Associated with that is anxiety and depression. So when I hear somebody say, I've got anxiety, depression, and pain, the next question is, did you have childhood trauma? And treating that trauma can go a long way to treat both the anxiety, depression, and the chronic pain. And unfortunately, not enough is made of this. Trauma therapies work, they are available. Not to say it's gonna make this all go away entirely, and not to say there aren't other things to be done, but focus on the trauma, because that's always in there, they're typically in there, and it can go a long way if you get proper treatment. Fizzing or squirting noise in the back of my head. It sounds like pop rock, very small bubbles. Moved to 2, went to the ER after hearing it with lightheadedness, said I'm fine, what's going on? That's a weird one, I don't know. Sometimes there can be actually air under the skin that can be sort of squishy and fizzy-like. Sometimes there can be literally connection with the chest if you have emphysematous changes with maybe a little bit of a pneumothorax. I will just say that whenever I hear weird stuff coming in or out of the head of the body that's new, I've seen brain tumors do this too, so let's get a CAT scan and check that out. How can I grow taller when I'm already 16? Filipino male, 5'3", parents are 5'2". Can I still grow taller? If so, what to expect leg lengthening? My goal is 5'6". 16, you're not at your full height yet. You can get your growth plates checked to see if they're fully closed, but even that doesn't tell you for sure. 16 at 5'2", I think you're gonna get close to 5'6", would be my prediction, but if somebody treats you like they give you growth hormone or steroids of some type to try to accelerate this. Sometimes it causes a premature closing of the growth plates, and actually you're making your ultimate height smaller than you would have been. So let nature do its course. I think you're on track. Stay positive. Desperate for armpit rash answers. Oh boy. Rash under both armpits, very painful. No insurance. He says it burns and stings. Okay. We put antifungal lotion on it. Good. Hard to know what this is. Probably an allergic reaction to something you're putting on your armpits. So it can also be a yeast or a fungus, a tinea it's called. And good that you put anti-fungus cream on there. The problem is if this is a burn or a intensive allergic reaction, so to speak, to something you put on your armpit, the antifungals can sort of make things worse. Unfortunately, the over-the-counter steroid agents are probably not going to handle this. This sounds a little more exuberant than that. This is my general note for everybody now. Use telemedicine. It's inexpensive. It's available. It's all the time. This idea that you can't afford medical care is wrong today. It's wrong-headed. You can at least see a physician, but don't go to an urgent care. If you go to urgent care, you go to the ER, you're paying for all that infrastructure. Go to telemedicine and just pay for the doctor or the nurse practitioner's time. Fiance had a bad reaction to Moderna. Her appointment's coming up for second. She's not sure she should get it. Main concern is having the effects be worse second time. This one I don't feel comfortable answering. Yeah, you'd really have to be under my care, and I'd have to take responsibility for that second shot if indeed I were recommending it. We all have a obligation to get the vaccine so we reduce the replication of this virus so there's no further mutations developing. I'd be hard-pressed to just, glibly tell you to take it, but if you were my patient, I probably would try to figure out a way we could do it safely. There are things you can do. Tired throughout the day, just sitting at my desk. Have to lie down for an hour. Should I mention rarely leave my house? Oh boy. 235, 6'1", male, 23, trying to improve my diet. Okay, so extreme fatigue is one of the more common medical complaints that doctors see. It warrants a thorough medical evaluation. Sometimes it is depression, sometimes it is a sleep disorder, but sometimes it's an underlying serious medical illness. Whether it's infectious or neoplastic, like a cancer, it needs a comprehensive evaluation. And now in the world of post-COVID, we can actually do cytokine evaluations to see if maybe it's a post-viral syndrome of some type, and there are things we can do about that. So my friend, even though you're 23, it's important you see a doctor about this. Where I get random medical questions is out in the world, and they're usually psychiatric, and they're usually very complex. And I feel bad about them because as people are asking me, the thought bubble over my head is, oh man, to treat this properly, let's see, today's Tuesday, be about 7 years to treat this thing fully. And they expect I can wave some sort of magic wand, have some magic intervention, which I do not. What I try to give them a frame and sort of send them and say, this is gonna take some work, and let it be. The internet has created a pandemic of Dunning-Kruger. You know what the Dunning-Kruger phenomenon is? Dunning-Kruger is not knowing much, but thinking you're an expert. As you start learning about a topic, you feel like you know it all, you're an expert, then you fall off a cliff and feel like you know nothing, and you start crawling out of that cliff, and you slowly start developing actual expertise, and at the point which you really are an expert, that's about when you develop imposter effect. You start feeling, oh my God, there's too much to know, I don't know anything. That's a real expert. Real experts don't feel like they know everything. And unfortunately, the internet has created this pandemic of Dunning-Kruger where people mistake information, knowledge, and wisdom. These are very different topics, and knowledge and wisdom require experience and a broad education on whatever topic somebody is reading about. And it's helpful when patients come in for medical problems and they have information. You want them to be well informed, but I don't want them believing they know what the right decision is for them. Decisions require wisdom and experience.